High-field MI has been an evolving area of MI research in the past few decades, culminating in the FDA and EU clearance of ultra-high field 70 for clinical diagnosis. Emerging clinical value of 70 MI has been demonstrated in epilepsy, multiple sclerosis, planning for deep brain stimulation, cerebral small vessel disease, brain tumors, and musculoskeletal imaging. However, significant barriers remain for the sustainable and value-based translation of 70-MI for routine clinical use. The 70 Translational Alliance of North America, 7TANA, was formed to facilitate the translation of the powerful imaging capabilities of 70MI to real-life benefits for patients, healthcare providers, and researchers in North America and worldwide. The 7TANA will provide resources for patients and caregivers seeking 70MI, facilitate the standardization of imaging protocols, sharing of data and expertise, formation of multi-site trials for the discovery and evaluation of clinical value of 70MI. As an initial step, we present a recent survey of neuroimaging protocols across 7 sites that include 7 major MI vendors to show the state-of-art 70 systems and the potential for common 70 neuroimaging protocols. 7 was formed in July 2023 at the University of Southern California, and the second annual meeting was held at the Center for Magnetic Resonance Research, University of Minnesota, in 2024. To date, 7 consists of 34 70 sites in the US and Canada, representing all 3 major MI vendors. 2070 MI systems are FDA cleared, while the rest are investigational systems. Following in-person and virtual meetings, we conducted a survey of neuroimaging and MSK protocols across all 7 sites from May to July 2024. This abstract describes the procedures and the results of this neuroimaging protocol survey. The sites were requested to present a basic neuroimaging protocol that is essential for clinical diagnosis, and an advanced neuroimaging protocol that is tailored towards specific disease and our research study. The sites were required to fill out sequence name, imaging parameters, including 2D or 3D slice orientation, imprint resolution, slice thickness, magnetization preparation, TR, TE, TI, flipping angle, acceleration, scan duration, etc., and whether contrast was used. The survey results were examined by an experienced 70 neuroimaging research to avoid duplications and to use standard sequence names across different 70 systems. The cleanup results of basic and advanced protocols were visualized using Sankey and Sunrise plots, respectively, with the frequency of each sequence cross survey sites recorded. Finally, the range of imaging parameters of the common protocol were listed in a table. A total of 11 710 sites responded to neuroimaging protocol survey, and all 3 major MI vendor systems were presented. As shown in Sankey plot of Figure 1 and the Sunrise plot of Figure 2, the basic neuroimaging protocols converge to T1-weighted MP-RAGE, T2-weighted GRE or SWI, DWI, T2-weighted FLAIR, T2-weighted TSE, T1-weighted MP2-RAGE, and post-contrast T1-weighted MP2-RAGE, which performed at greater than 50% of the sites. As shown in Sankey plot of Figure 3 and the sunrise plots of Figure 4, there are considerable heterogeneities in the advanced neuroimaging protocols with TOF-MRA, QSM, DTI, L-Hardy, and BOLD-FMI as the most frequently performed techniques across the 11 sites. The range of imaging parameters of the common basic protocol are listed in Table 1. Figure 1 shows the Sankey diagram of basic neuroimaging protocols across 11 710 sites. The basic neuroimaging protocols converged to T1-weighted MP-RAGE, T2-weighted GRE-SWI, DWI, T2-weighted FLAIR, T2-weighted TSE, T1-weighted MP2-RAGE, and the post-contrast T1 MP2-RAGE that was performed at greater than 50% of the site. Figure 2 shows the Sankey diagram of advanced neuroimaging protocols across 11 710 sites. There are considerable heterogeneities in the advanced neuroimaging protocols with TOF-MRA, QSM, DTI Hardy, and BOLD-FMI as most frequently performed technique across the 11 sites. Figure 3 shows the sunrise plots of basic and advanced neuroimaging protocols across 11 710 sites, which shows similar information as Figure 1 and Figure 2 of the Sankey plots. Figure 1 shows the median and the range of imaging parameters of the common basic protocol. This study represents the initial step of 710 to understand the state of the art as well as heterogeneity of neuroimaging protocols across 70 sites. The survey results demonstrate that it is feasible to develop a common standard protocol through consensus of the 710 community, despite the considerable difference across 70 hardware and software platforms. Further harmonization and testing of such common protocols are warranted, with Penton and traveling cohort across 710 sites. The common and advanced neuroimaging protocols will be available on the 710 website to facilitate the translation and dissemination of 7TMI for routine clinical care.